Good afternoon and welcome to this short Facebook message on sexual health, because this week is Sexual Health Week. My name's Anne Connolly, I'm a local GP and also the clinical lead for sexual health across the three CCGs of Bradford and Airedale. Now, as I say, this week is Sexual Health Week and it's a national campaign, and this time it's on talking porn. Now, the main thing about talking about porn is to try and encourage young people to understand the risks that are out there on the internet and the choices that are sort of being taken away from them. So the aim is to encourage young people to talk, communicate with others, communicate with other carers and friends, to understand that about their own body image and their own expectations, and then to be able to make their own choices. The other point about this week is that it's trying to encourage people to look at the very useful online resources that there are to allow people to make choices about their own contraception and their own sexual health. One of the best resources, particularly for young people, is the website Brooke. This very clearly explains about sexually transmitted infections, about the risks, about the fact that most don't have symptoms, about the tests and where you can get them. We're going to put the website addresses below this message on Facebook so that people can have a look and find the resources and help others to find the resources too. Now, I want to mention contraception a little bit more, because there are many contraceptive choices, and sometimes it's too confusing because you don't understand which one would be right for you at which time. Now, the Family Planning Association, or better known as the FPA, on their website, they have this option of using a contraceptive tool. This is a quick quiz. It outlines all the different methods that are available, and it helps you to consider which methods might be right for you at your time of life. So you go onto this online, it is all free, and follow the instructions and the questions. So basically, when you're thinking about a contraceptive for you, you have to decide, and my basic message when I'm talking about this in clinic is, when do you want to be pregnant? Do you want to be pregnant this year? Or do you want your partner to be pregnant this year? Or maybe it's something that you will be planning for the future. Now, as I say, there are 15 methods of contraception that are available for us in the UK. These at the top here are what we call the long-acting methods. They are the much more reliable methods. And if you're not considering a pregnancy this year, it is well worth having a look and choosing whether one of these methods would be good for you. We have the implant. This is a little rod that sits under the arm. It sits in the skin underneath the top of the arm. It needs to be felt, but it isn't visible. And this lasts for 3 years. We then have the hormone coil. This sits inside the womb and delivers a hormone inside the womb, and this one lasts for 5 years. This one is the copper coil, and we have lots of different types of copper coils, but they can last anywhere between 5 and 10 years if you want them to. Now, these are the better methods because once they're there, they are there. You don't have to be worrying every day about taking a tablet, or you don't have to be worrying about when to go for your next injection. 3 years, 5 years, 10 years. For some people that sounds like too long, but you can have them removed earlier if you then want to plan a pregnancy at a time that's right for you. If you decide that you don't want to use one of these methods, then obviously we've got lots of different pills that are available, but you need to be remembering to take them every day. And the pill often fails because people forget to take them. There are ways of helping remind you to take the pill, such as an app on your phone or a reminder on your phone, but they are much less reliable because of this need to be better at complying. And there is the injection, which you can get once every 3 months. Now, lots of GPs will provide these methods. All GPs will provide the pills and the injection, but if you can't find, if your GP does use to fit one of these, or you want to choose to go to the sexual health clinic in the centre of Bradford, then this is now run by Locala. Locala, you can find the details of their clinics on Locala, and again we will put that on this message beneath this short film here. But you can look at the times, the clinic times. There are clinics in Keighley, in Bingley, in Windhill Green, in the centre of Bradford at Howard House, and out at Bowling Hall. One last point is always to think about your sexual health. Condoms are not a great contraceptive at all because they sometimes come off or they burst, or sometimes they're not used reliably. But they are a very good way at preventing sexually transmitted infections. So using a contraceptive method and a condom is ideal, particularly if you do have more than one partner or you have changed partner. Now the very final point to make is about sexually transmitted infections. As I've said on the Brook website, there's lots more detail about these, but most sexually transmitted infections don't have any symptoms. And that means you can pass them on from one sexual partner to another without knowing it. So it's always worth going and get tested. Tests are easy to do. For women, it's usually taking a swab yourself, which is very simple to do. And for men, it's doing a urine test. So gone are the horrors of the old tests that rumours abound about. It is just very simple. And if you've changed your partner recently or haven't had a test in the recent past, then either go and talk to your GP or go down to one of the local sexual health clinics. Drop-ins every morning, Monday to Friday, at Howard House in the centre of Bradford. So think sexual health, think about protecting yourself, think about your contraceptive options. There are lots of resources out there. Thank you for listening.